On your responses to the COVID challenge, from a health point of view, the preparedness, I must commend you in going about setting up the various centers that are going to have to be utilized as we address the whole challenge, setting up centers where our people will need to be treated, which you are now going to take me to go and see. The level of preparedness is quite impressive, because you've identified various places where people will need to be placed either for isolation, for quarantine, for treatment as well. The ICU centers that are also being set up. The beds that are now getting ready to receive the people who will inevitably have to be treated is something that is commendable. And I want you to increase the number of the beds. These are good numbers of beds that you have identified, some of which I will see, the ICU centers. But I'd like to see more of these because KZN is very highly populated, and Professor Karim and his colleagues who are dealing with this disease from a scientific point of view inform us that as South Africans, we must expect that the rate of infections is going to increase. They also inform us that we've done extremely well in leveling that curve. We've got to plan, and I'm afraid we've got to plan for the worst. We are informed that the worst is still coming. We are going to get more people infected. But the important thing is that we need to ensure that we lessen the pace through which these infections are going to take place. And we'll be able to do that, one, by getting ready with all these facilities, two, by ensuring that there continues to be social distancing, people continue to wash their hands on a continuous basis, because we're informed that it is through our actions as individuals that we spread the virus, and also by wearing masks, as we now do, all of us, particularly when we are in public places like we are now. I want to also commend you by addressing the other challenge that COVID-19 has presented us with, the distress amongst our people who, through the lockdown, have had to stop work, have had to stop their normal economic activity. At national level, we responded to this. This was a necessary intervention that needed to be made, and you have been handling it extremely well at the provincial level, and utilizing the pillars and the structures that you've got of Operation Sugumasake. You've been able to address the issue of households that are in distress and families that are in distress, up to and including on issues such as the distribution of food, and doing it in a very organized way, without getting our people to lose their dignity and to lose their humanity. And I'd like to thank you for that as well. On water, which is a major challenge for you here in KZN, and this is known, you have also gone about beginning to address the issues at short-term level, but there is a medium term, but in my book there is a long term. We do need, on a long-term basis, to address the issue of water in KZN. And this COVID-19 moment has given us the way and the wherewithal to be able to do a lot more than what we have done in the past. You highlight very well something that is very important in my mind, the issue of hygiene. We identified hygiene as a key area that we need to address. I guess with the lockdown, we were not able to wrap our hands properly around it, but the time as we move down to the other levels of the lockdown has now arrived for us to clean up our country. We now need to embark on a massive, massive campaign countrywide to clean up South Africa, to deal with issues like waste dumps that are in wrong places, and hygiene, and clean up the streets of our country and the rural areas as well. So beyond the various levels, the time will now have arrived for us to clean up our areas, even high-density areas or congested townships. There is just no reason why our people should continue living in squalor, in unhygienic places. As we deal with the issue of COVID-19, making sure that we deal with the sewage, with the sanitation issues. We need to disinfect public areas, but also clean up our country. And we will want to embark on massive campaigns to clean up where people congregate, be it taxi ranks, be it bus ranks, and many other places. So this will give us the opportunity to be able to do so. Also address those challenges that COVID-19 is going to yield at the economic side. And my view is that we've got to begin to put in place the pillars of a new economy. We cannot continue in the same old way. New economy where we are now going to identify possibly new sectors of our economy going forward, rebuilding those that have been badly affected by COVID-19, but also finding new sectors that we now need to put in place. Many people are going to lose their jobs. We need to find and create and build jobs for the many of our people who are going to lose jobs. We need to be asking ourselves, what is this new vision that we envisage for our country going forward? We need to come up with a clear economic strategy, and the building blocks are already in place. We now need to put them all together. The important principles is that it must be an economic future that is going to ensure that the growth that we will have is inclusive. It must also be empowering to women, to young people, and to black people in the main. Radical economic transformation must underpin the economic future that we will need to craft going forward. But we should be able to do this through a new compact that we are going to build. A new compact amongst all key role players in our economy, in our country, labor, business, community-based organizations, and government.
For more, go to ewn.co.za.